assessors. If you do have any questions prior to that, like I said, please drop it in the chat. This morning, we're going to be talking about the 2023-2024 influenza season. Just a few housekeeping. Please ensure that you're muted throughout the presentation unless you're speaking. And a reminder for the QA team, please monitor the chats for any questions you may be able to answer. A reminder to attendees, today's session is being recorded. Slides and webinar recordings will be uploaded to the VFC, the Hawaii VFC website, and we should be dropping the slide, a PDF of the slides in the chat. If you would like to be added to the Hawaii VFC program email list, please email your request to hawaiivfc@doh.hawaii.gov. And in the subject line of the email, please write email list. And if you have any questions during today's webinar, please use the chat to ask your questions so that our subject matter experts can respond directly, and we will be answering your questions at the end of the presentation. By the end of the presentation, providers will be able to learn where to obtain the national and Hawaii-specific influenza surveillance report, understand VFC influenza vaccine ordering, storage requirement and barring guidance, and learn about school-located vaccination clinics. Our speaker this morning will be Lorraine. She's one of our quality assurance RN assessors. Up to you, Lorraine.
Hi, good morning. Hi, good morning. Thank you for being with us today. Okay, let's start off. So where can you obtain weekly national influenza surveillance report? So the CDC has the influenza division, which collects, compiles, and analyzes information on influenza activity year-round in the United States. So the link to the surveillance report is on the screen. And next slide, please. This is what you would see on the surveillance report page. So if you can click on that, Joe. Okay. So the CDC updates this report every Friday. So you can see in here it's updated February 2nd. For this week, they are reporting week 4, and it's ending in January 27. See here, you can see the clinical lab. It is trending up, the positive influenza specimens for this week. It's trended up compared to last week. You can see the outpatient respiratory illness, which is stable, but generally the seasonal influenza activity remains elevated nationally with increases in some parts of the country. You can see here the pediatric deaths, and down here, there are some key points for this week's report, and a little more detail about the different reports they have. So in here is the clinical lab. So out of the 93,011 specimens tested, 16.2% of that is positive with influenza. Here's the public health laboratories report. So the difference between the clinical labs and the public health report is that clinical labs report is primarily diagnostic, and the public health laboratories report is mainly for surveillance. You can see here more data about it, and the genetic characterization of the virus, the subtypes, and then information about the outpatient respiratory illness surveillance, the visits for this week, age group, which we can see that the 0 to 4 and the 5 to 24 is high. And in here, you can see an activity map, which will represent the outpatient respiratory illness. This is not the laboratory confirmed influenza, but mainly for respiratory illness that includes fever, coughs, and sore throat. So if you would play here, it will start on week 40, which is in October last year, up to week 4. If we'll play it, you can see the trend, and Hawaiian here is still from minimal, went to low, and then you can see here, I'm gonna go back and let you see the, on week 52, which ended in December 30, Hawaii was like in moderate level, which okay, comparable to all the other states, which is, you can see they're either in high and very high activity level. Good thing is on week 4, we went back to minimal, but we should still take precaution because we have a high volume of tourists, and our climate is tropical, so we're still, we need to take precautions. And okay, let's proceed to the next slide. So how about the weekly seasonal influenza trends in Hawaii? So each week, the Hawaii Department of Health publishes influenza report that informs you of various influenza trends in the state. So next slide, please. This is from week 3, January 14 to January 20. This is the positive influenza cases in Hawaii by age group. And as you can see, although all children younger than 5 years old are considered at higher risk for serious flu complications, the highest risk is for those younger than 2 years old. So it's evident in the data here that younger than 2 years old is really the highest risk for flu. Next slide, please. This is what you will see in the Department of Health influenza report. So you can see the current report here and the archived reports from the past years and the past week as well. If you can click on the hyperlink, it will take you to the website. If you can click on this one. So in here, this is the report snapshot for the week. Outpatient visits related to influenza-like illness is 3.8%, which is higher compared to the previous week. Laboratory surveillance, 12% of all the specimens tested for week 3 is positive for influenza. And in here, unfortunately, it included like one influenza-associated pediatric death in Hawaii. This was reported on week 1 of the surveillance report. So here you will find more details about the data. So for week 3, the total specimen received was 3,521, and out of it, 424 is positive for influenza, which is 12%. So this is the age distribution that I just showed you earlier. More data about the lab testing. Positive RSV test by influenza season. positive influenza test by influenza season, and more information about it. Okay, let's move on to the next slide. The CDC Immunization Schedule you can find it in the link below, as well as the summary for the Advisory Committee on Immunization Practices recommendation for this influenza season. Seasonal influenza vaccine. Next slide, please. Okay, this is from the CDC for the recommendation for influenza vaccination for age 6 months to 8 years who have received fewer than 2 influenza vaccine doses before July 1st, 2023, or whose influenza vaccination history is unknown, 2 doses separated by at least 4 weeks, and administer dose 2 even if the child turns 9 between receipt of dose 1 and dose 2. And for ages 6 and 8 years old who have received at least 2 influenza vaccine doses before July 1st, 2023, they only need 1 dose. And for 9 years old and older, 1 dose is recommended. Next slide, please. Okay, this is the guide from immunize.org. You can print it out for your staff. Yeah, this is really helpful. Next slide, please. What is the maximum allowed volume per intramuscular injection site for vaccination? So the CDC, per CDC, these are the suggested volumes. For deltoid, average is 0.5 ml, range is 0.5 to 2 ml. For the vastus lateralis, average is 1 to 4 ml, and range is 1 to 5 ml. Infants and toddlers would fall at the lower end of the range, whereas adolescents and adults would generally fall in the higher end of the range. Some strategies healthcare providers can use to decrease number or injection volume include that healthcare providers should always use professional judgment when administering injections. Muscle size can vary greatly from one patient to another. Include an age-appropriate combination vaccine in the facility's inventory, like Pentacell, Pediarix, and Vexelis. Use an alternate route other than IM if possible for IPV, single component, not a combination of vaccine, MMR, toddler and infant travelers only, varicella-containing vaccines, toddlers only, and PPSV23 for high-risk toddlers only can be administered subcutaneously. You should take advantage of the recommended age ranges some of the routinely recommended vaccines have. For example, the 3rd dose of Hep B can be given as late as 18 months of age. And of course, staff education is really important. Staff education of all those strategies in there. Next slide, please. Influenza vaccine ordering. So for seasonal and allocated vaccines, we use a paper form. So this is the seasonal influenza vaccine order form for 2023-2024. Online ordering through HIR is unavailable due to monitoring of allocation. So fill this up and then, fill this out and send it to our VFC email. Next slide, please. Hawaii VFC vaccine, influenza vaccine inventory update. So these are the vaccines that we currently don't have. Flucelvax, Hawaii has exhausted our allocation, so 0 doses available for order. And the Flu Mist, CDC has ceased distribution for the current influenza season due to short product dating. So what are the available vaccines for VFC for influenza? Next slide, please. So we have here the Flulaval, Fluarix, and Fluzone. quadrivalent. So all is in a 0.5 ml pre-filled syringe presentation. This is as of today. These are all the available flu vaccines. Next slide, please. For the expired influenza vaccine at the end of the season. So expired VFC influenza vaccine should be returned in the same manner as all other VFC vaccines. You should complete this vaccine loss reporting form to initiate the return of the excess expired influenza vaccine at the end of the influenza season. Next slide, please. Influenza vaccine storage. All influenza vaccines must be refrigerated at a temperature between 2 to 8 degrees Celsius or 36 to 46 degrees Fahrenheit upon receipt and must maintain within temperature range until expiration date is reached. Do not freeze the influenza vaccines. Next slide, please. Influenza borrowing. Borrowing should only be one directional for seasonal flu vaccine. Providers may use private stock for VFC eligible children and replace it when VFC vaccines become available. So providers should not use VFC flu vaccines for private stock due to limited allocation. This is to ensure that our VFC eligible children receives the VFC influenza vaccine. Next slide, please. All the images that you see here is from CDC. They have a resource center for influenza where you can download free communication and education materials to promote flu vaccination. So there's a link over here. Next slide, please. School-located flu vaccination efforts. So the Department of Health is conducting partnership with Hawaii schools in protecting the health of our community by serving as a facilitator to connect schools with community vaccination providers. We are currently seeking vaccination providers to conduct community and or school-located vaccination clinics. So our contact for Bridget Anthony is our community vaccination program specialist. And next slide, she will be talking more about this program. Next slide, please. Bridget, turning it over to you.
Hi, my name is Bridget Anthony. I'm the Community Vaccination Program Specialist, also the Stop Flu at School Coordinator. Next slide, please. So in 2007, the Department of Health had a Stop Flu at School program. It was basically a statewide school-located influenza vaccination program that offered influenza vaccines without cost with parents' consent to kids in grades K through 8th. The main objective was to decrease influenza disease and complications resulting from influenza in school children. However, unfortunately, it was suspended in 2021 as a result of our resource and staffing constraints that were exacerbated by the COVID pandemic. Next slide, please. So although the DOH is not able to offer the Stop Flu at School program any longer, we developed kind of a new model of promoting flu vaccination clinics in schools. So now we serve as a facilitator to connect schools with non-DOH immunization providers. So basically below is the process on how to reach out if you are a provider and you're interested in hosting a vaccination clinic. So you reach out to me. That's my email and my phone number. We send out a Department of Health school survey to all public, private, and independent schools and charter schools to determine which schools are interested in hosting a school-located vaccination clinic. Once we get the results of the schools that are interested, we would connect the vaccine provider with schools to host the event. And then we would collaborate with the vaccine provider in this school and move forward with setting up the event, such as coordinating, scheduling the date, consent forms that have to be sent out and reviewed. Next slide, please. So this is a list of the community flu vaccination providers we've worked with in 2023. We've worked with Kaiser, PharmaCare, Kalihi Palama Health Center, Wahiwa Health, Waikiki Health, and Champs Pediatrics. So as you can see, we've worked with private providers, FQHCs, pharmacies, and community-based organizations. Next slide, please. This is the list of the completed school-located flu vaccination clinics we did in 2023. We did 23 clinics. Like I said, the community vaccination partners we partnered with were FQHCs, pharmacies, private providers, and community-based health organizations. They mostly provided the flu vaccination. However, the FQHC provided COVID vaccinations as well. We've done them on Oahu and Maui, but we're looking to expand and grow and do some flu vaccination clinics on Kauai as well for next year. And then we've worked with public schools, private schools, independent schools, and charter schools. And we've done these clinics at elementary schools, middle schools, and high schools as well. Next slide, please. So our next steps, we're basically looking to grow our list of vaccination providers so that we can expand to more schools and have more clinics in these schools. So we're seeking community vaccination providers to conduct more for the 2024-2025 school year. So if you're interested in partnering to conduct a vaccination event, please reach out to me, and below is my email and my phone number. And I can answer any questions if anyone has any questions. Thank you.
Thank you, Bridget.
Yeah.
This is our contact information. If you have any questions regarding HIR, we do have our HIR information here. If you have any questions on VFC vaccine ordering or VFC related questions or concerns, you can contact our VFC QA team. And this is our post-webinar satisfaction survey. Please fill it out. The link should be in our chat, as well as the link to, we should be dropping it soon, the link to our Hawaii VFC website. That's the end. Do you have any questions? If you do have any questions, please feel free to unmute yourself, or please drop your question in our chat. We will be here until 10 a.m. If you have any questions, you can pop back in. But otherwise, thank you for joining us today. I just dropped the links to our VFC website, as well as to our virtual office hours survey. We would appreciate if you could fill it out so that we can find out more information on whether you are interested in a different day or certain topics. Again, thank you for joining us.